everyone. This is Evelyn from the Wright State Lake Campus Career Perspectives podcast. And we are once again out in the community, and we are so lucky because today we get to be with Shelly Rupert, who is the Executive Director of Human Resources for Grand Lake Health System. So before we get started, thank you so much for being here.
Thank you for having me.
We are very, very lucky. And anyone who watches our podcast, when we go out and talk with employers, we always have 4 questions. But today, before we get to them, I'm going to give Shelly an opportunity to kind of clear up something that's a little muddy for a lot of people listening. And that is where we are sitting right now is sometimes referred to as Joint Township. Sometimes people use the whole title and they say Joint Township District Memorial Hospital. And then other times, so here's the third way, sometimes people refer to it as Grand Lake Health System. So Shelly, I want to go ahead and give you the opportunity to make it a little less muddy for the rest of us. What should we call where we are?
Well, all 3 of those are correct. So if you think of Grand Lake Health System, that is our overall general umbrella. That's our big umbrella that we all fall under. Think of it as a marketing name of how we name our whole organization. Underneath that is Joint Township District Memorial Hospital, also sometimes known as JTDMH or Joint Township Hospital. You'll hear it shortened. That is our big entity underneath that big umbrella. So that is our hospital and where we're sitting today, where the majority of our employees fall. We also have Grand Lake Physician Practices, which is 12 different physician practices that we own and operate throughout the community. We have offices in St. Mary's, Salina, Wapak, and Minster area.
And are you part of hiring for more than just our location then? You mentioned 12 different offices.
Yes, our HR department is responsible for all of that, correct.
Okay, so we need to listen up because this is all going to help people trying to apply for, gosh, this and 12 offices?
12 offices,
So
yes.
13 altogether?
Correct,
13
yes.
locations? Okay, well, here we go. You already know what the first question is if you have listened to this podcast before. And that is, Shelly, I want to know from your perspective at Grand Lake Health System, what do you wish more applicants knew? And that can either be in regards to their application, their resume, or the interview them itself.
Sure. My big preach, I've been with this hospital for about 20 years, and when I first started here, I did all of the initial interviews for the hospital. So one of the things I noticed very quickly on is when you sit down with somebody, they're nervous, right? It's your natural instinct to just be very nervous, fidgety, and not want to come out of your shell. But that doesn't do any good in an interview process. So one thing I learned early on, and I still do to this day, we recently had an HR position open in our facility, so I was doing some of those interviews, is I try at the start to put the person at ease. Try to really break that tension in the room and give them the speech that it goes both ways. I'm not just interviewing them, but they are interviewing us as well because it needs to be a fit in both directions. So that's something I preach early on. I try to tell them, I want this to be a conversation.
Yeah.
Please don't be nervous. Please speak up if you have questions because their questions are just as important as our question because we can hire them and if they don't ask any questions and we don't answer any of their questions, they could be unhappy 2 months in. So we want it to be a fit in both directions. That would be the biggest thing I would tell applicants is to, as best as possible, put yourself at ease, come in early, let yourself breathe a little bit, whatever works for you, listen to some relaxing music, and make sure you come in prepared and ready to go.
So that's some wonderful tips. Come early so you're not nervous about where do you park and what entrance do you go in. Also, Shelly gave the tip of listening to relaxing music or whatever relaxes you. And we were talking earlier before we started the podcast, and one of the things you alluded to was, if there's a position available, we want you. So go into that interview thinking they want me to do well. They are hoping they are done interviewing after me and they can move on to other things you need to do. It's the worst case scenario for you for it not to be a fit because that means you got to keep interviewing people.
Very
right?
true. The healthcare field has been challenging with COVID and everything we've been faced with the last couple of years. So we absolutely want to hire you. We go into every interview hoping it's a success because it's just a win-win on both sides if we're able to hire a good candidate from that interview.
So now we know what you want. what are red flags on a resume or interview that as soon as you see them, you think, oh man, so close, but now that's giving me a red flag?
Well, from a resume's perspective, it's the little things. It's the take your time, and make sure you're writing, if it's a handwritten one, write it neatly, type it neatly, check your spelling. I have a 16 and 17-year-old children, so I've had this conversation with them. You can't just go in and type whatever, just do it real quick and get it done. That's the mentality of the younger generation these days. Take your time, make sure it's accurate and complete, and make sure you champion yourself when you have things to say. So don't just skip past a question. Brag about yourself. This is your chance to tell your future employer what you're able to offer to them.
That I love that word, champion. So many times I find that people new to the interview world, and maybe it's their first time getting a job because they're just getting ready to graduate from Wright State, hopefully, that they maybe don't have the understanding of confidence versus cocky. And confidence is saying, I have the skills that I think would be an amazing fit for this position. What I don't have, I'm ready to learn, I'm open to learning, but you don't know that. People don't even get to the interview situation where they can tell you that unless they make it past the application, right?
Correct. And if we're lucky, we might have 20, 30 applicants for one position. So what makes you stand out? What's going to make that person looking through 30 applications go, wow, I want to talk to this one.
So talk about yourself. Yes. Okay. So that kind of goes into my next question, which is how does someone shine? So you said things like make sure to be confident in your skills, make sure to list the skills you have. Any other thing on whether it's a resume, an application, or in person that really makes someone stand out for you?
I could go on and on about this one, honestly, but I won't do that. I know we do have a time limit, but here at Joint Township and probably any healthcare facility, but especially at our healthcare facility, we are large on customer service. So how can you, and that's with any position, that's not just nurses or doctors, that is any position, whether you're behind the scenes or right on that front line. How do you engage with people? So again, back to the basics of eye contact. Tell us about you. We want to hear your story. If you're too quiet in an interview and you're just kind of sitting there shaking your head and not really giving much information, we don't get to know you. We don't get to make that connection. So in any way that we can make that connection and try to see your personality, we can train anybody on job duties. We cannot train you on personality or on your work ethic. So if you can bring that to the table, that goes a long way with us.
That's phenomenal. Shelly already knows this, that one of the reasons that we're here, and she is the first one that's on the podcast for nursing. Don't worry, we'll get out there to the other nursing facilities eventually. But Joint Township, it is geographically close to Wright State Lake Campus. They have always been so good to us, as well as other nursing facilities as well. But you all were just at the job fair that Lake Campus had 2 weeks ago on Monday. Not only did they interview and talk to tons of people, they even offered one of our students a job on the spot. So I know you all are not only open to Wright State Lake Campus students, you're excited about them. You are just, I will tell you, before we started this podcast, her and another wonderful person who works here, whose name is Lisa, was so excited to tell me about how wonderful the Lake Campus nursing students that they met 2 weeks ago on Monday, how wonderful they were, how positive they were, what great attitudes they had, and they were so excited to the job offers that they put out that day. So I want to go ahead and transition into what opportunities are there at Joint Township, Grand Lake Health System, the whole umbrella, and don't be afraid to mention something that's not available maybe right now, but you see is coming, because not just seniors listen to the podcast, it's freshmen through junior. Just before Shelly starts, a lot of people think hospital nursing. But hospitals need accountants. They need graphic designers for their logo. There's other people than just nurses. So go ahead and take it away.
Absolutely. Well, first of all, thank you for the opportunity to be at your job fair. Wright State Lake campus is obviously close by to us.
Yeah.
We've had a great partnership for many years. We have some of their nursing students on site right now for their clinical rotations. So that job fair was excellent. We were able to make a connection, again, back to that making a connection with somebody. And if we can do that with a nursing student and get them in here and kind of get their feet wet, that's just a win-win for us, because hopefully they enjoy it, and that's what we've seen over the years, and then they stay with us as a nurse down the line. We have excellent seniority here. A lot of people, once they're here, they stay here. As far as looking for job opportunities, they're all listed on our website. It's www.grandlakehealth.org. So of course, make sure you check that out and see what we have available. Anything listed will be on there. We do a lot with students. Again, she hit the nail on the head there as far as the clinical and non-clinical opportunities. So I know a lot of times when we're out at schools, you'll hear people say, "Oh, I don't like needles. I don't want to work in healthcare." Well, not all jobs work with needles in healthcare. So there is everything from all different behind the scenes where you're not even seeing a patient at all. So we have all different kinds of jobs. So don't write us off just because healthcare might not be your thing. So clinical, non-clinical opportunities, we have job shadowing opportunities. We work with the local TriStar Med Prep program and bring some of the students in and let them job shadow at all different levels to kind of see what they like, what they don't like about certain positions. We work with the local schools. We have volunteer opportunities as well. So if you're ever interested in volunteering here, that looks great on a resume. Plus you're able to help out your local healthcare employer, which is a win-win as well. A lot of different opportunities, and we'd be happy to talk to you about what you might be interested in.
Phenomenal. So go to that website. If someone would have any trouble with the website, or they didn't quite understand us when we said it, can they stop by this location?
They can certainly stop by.
Can you give them the address just in case?
Sure. We're at 200 St. Clair Street in St. Mary's, Ohio.
Okay.
We also have a general HR email address.
Oh,
that is
wonderful.
hr@jtdmh.org.
Perfect. Well, thank you so much for being with us.
Thank you for having me.
And again, this is Evelyn from Wright State Lake Campus. You know where to find me for resume help, cover letter help, job searching help, volunteering help. So don't be shy, and we'll see you next time. Bye.